Have you ever pondered the crucial role tracheal intubation plays in medical emergencies? Well, today we are going to delve into this fascinating topic. The tracheal intubation procedure is a cornerstone in emergency medicine and critical care, acting as a literal lifeline for patients in dire straits. So what exactly is the purpose of tracheal intubation? Firstly, it helps maintain an open airway. In emergencies where a patient's ability to breathe is compromised, tracheal intubation can ensure that air continues to flow into the lungs. This is vital in situations like trauma, where swelling or injuries may block the airway, or in cases of unconsciousness, where the tongue can fall back and obstruct the airway. Secondly, tracheal intubation facilitates ventilation. Sometimes a patient's lungs can't effectively oxygenate the blood or remove carbon dioxide. That's where a ventilator comes in. But to connect a patient to a ventilator, you need a tube in the trachea, hence, intubation. Next, tracheal intubation also plays a protective role. It's a safeguard for the lungs, preventing aspiration, which is the entry of stomach contents or other foreign material into the lungs. Aspiration can cause serious complications like pneumonia and acute respiratory distress syndrome. Lastly, tracheal intubation is also a route for administering certain medications. In emergencies, when every second counts and intravenous access may not be readily available, some life-saving drugs can be given through the endotracheal tube. So, from maintaining an open airway, facilitating ventilation, protecting the lungs to administering medications, tracheal intubation is a multifaceted tool in the arsenal of healthcare professionals dealing with medical emergencies. It's a procedure that requires expertise, precision, and a calm demeanor, even in the face of life-threatening situations. In the following scenes, we will delve into the steps involved in tracheal intubation, from preparation to post-intubation care. But for now, let's take a moment to appreciate the importance of this procedure. As you can see, tracheal intubation serves as a lifeline in many medical emergencies. Before we delve into the step-by-step process, it's key to understand what preparation entails. So, let's dive right in. The first stage in preparing for a tracheal intubation is patient positioning. It's crucial to position the patient correctly to maximize the likelihood of a successful intubation. Typically, we use the sniffing position. This means the patient's head is extended and the neck is flexed. It aligns the oral, pharyngeal, and laryngeal axes, making it easier to visualize the vocal cords. Next in line is pre-oxygenation. This is an essential step to prevent desaturation during the intubation process. We aim to fill the patient's lungs with as much oxygen as possible, which will act as a reservoir during the procedure. This is achieved by having the patient take deep breaths of 100% oxygen for about 3 to 5 minutes. Alternatively, 8 deep breaths over a minute can also be effective. Patient cooperation is also a crucial factor in successful pre-oxygenation. In uncooperative or agitated patients, methods such as high-flow nasal cannula or non-invasive ventilation may be used. The aim is always to maximize oxygen delivery and minimize the risk of desaturation. Now let's talk about equipment checks. You want to ensure that all necessary equipment is ready and in working order. This includes the laryngoscope, the correct size endotracheal tube, a stylet if required, a syringe to inflate the cuff, and a bag mask device. You should also have suction available and backup airway devices at hand. Remember, the key to successful tracheal intubation is preparation. Take time to position your patient correctly, ensure they are adequately pre-oxygenated, and always double-check your equipment. It's also essential to have a backup plan in case the initial intubation attempt fails. This could include alternative airway devices or even a surgical airway. With the proper preparation, we pave the way for a successful tracheal intubation. So let's move on to the next step where we'll discuss patient assessment in detail. Stay tuned. The first step in the process of tracheal intubation revolves around patient assessment. This is a critical juncture where healthcare professionals examine the patient's airway, breathing, and circulation, often abbreviated as the ABCs. Assessing the airway involves checking for obstructions or anatomical abnormalities that could complicate intubation. Breathing assessment, on the other hand, determines the patient's respiratory rate and depth, signs of respiratory distress, and the adequacy of oxygenation. Finally, the circulation assessment checks the patient's heart rate, blood pressure, and signs of shock. These are all vital signs that could affect the patient's ability to withstand the procedure. In essence, this initial assessment is like a triage, identifying potential challenges and risks before they become problematic during the procedure. By thoroughly evaluating the ABCs, healthcare professionals can plan a strategy that maximizes patient safety and increases the chances of successful tracheal intubation. Patient assessment sets the stage for successful tracheal intubation. Once assessment is complete, the next step involves choosing the right equipment. Now, the world of tracheal intubation tools is vast, but don't worry, we'll break it down for you. Firstly, we have the laryngoscope. This device is used to visualize the vocal cords and guide the tube placement. There are different types of laryngoscopes, but the choice primarily depends on the patient's anatomy and your own comfort level. Next, we have the endotracheal tubes. These come in various sizes. The tube size selection is based on the patient's age, gender, and body size. Then there's the stylet, a flexible instrument that gives the endotracheal tube its shape during insertion. Finally, we have additional accessories like suction devices and tube securing devices, which assist in the overall procedure. Remember, every patient is unique, and the equipment selection should be tailored to their specific needs. Selecting the right equipment is a crucial step in the process of tracheal intubation. After selecting the equipment, it's time to position the patient appropriately. The optimal position for tracheal intubation is often referred to as the sniffing position. Picture a person trying to sniff a delightful aroma. The head is slightly extended, and the neck is subtly flexed. This alignment opens up the airway and provides the best line of sight. Now, not all patients can achieve this position due to injury or other medical conditions. In these scenarios, improvisation is necessary. You might use pillows or blankets to prop up the patient's head and shoulders, creating a similar effect. Remember, the goal is to align the oral, pharyngeal, and laryngeal axes for the easiest possible intubation. Regardless of the method used, be gentle and communicate clearly with your patient. Your reassurances can help reduce their anxiety and make your job easier. Proper patient positioning can make the difference between a smooth process and a challenging one. Now that the patient is properly positioned, it's time to perform the intubation. The journey to successful tracheal intubation begins with the insertion of the laryngoscope. This special instrument is used to visualize the larynx or voice box, which is the gateway to the trachea. The laryngoscope is inserted gently into the mouth, gliding along the middle of the tongue towards the back of the throat. Remember, it's important to be gentle and avoid any sudden movements that could cause discomfort or injury. Once the laryngoscope is in place, we can start to visualize the vocal cords. The laryngoscope blade is used to lift the tongue and epiglottis, revealing the glottis, which is the opening between the vocal cords. It's crucial to remember to lift, not lever, the laryngoscope. You're not prying open a stubborn door, but rather, lifting a delicate curtain to reveal the stage beyond. With the vocal cords in sight, the next step is to pass the endotracheal tube. This tube is what will provide a secure airway for the patient. It's inserted through the mouth, passing between the vocal cords and into the trachea. The smooth, rounded tip of the tube helps to minimize any potential trauma. The tube's position can be adjusted as necessary to ensure that it's properly placed within the trachea. Now that the tube is in the trachea, it's time to inflate the cuff. The cuff is a small balloon-like component located near the end of the tube. When inflated, it creates a seal within the trachea, preventing air from escaping and ensuring that the patient's breaths are effective. The cuff is inflated using a syringe, and the amount of air required will depend on the specific tube and patient. Once the cuff is inflated, it's time to confirm that the tube is in the right place. This is usually done by listening for breath sounds on both sides of the chest, ensuring that air is flowing into both lungs. Other methods, such as using a capnograph to measure exhaled carbon dioxide, may also be used. But we'll get more into that in the next scene. It's worth noting that this step-by-step process I've described is a simplification. In reality, tracheal intubation requires precision, skill, and the ability to respond to unexpected challenges. It's a procedure that demands a great deal of practice and experience to master. And of course, it's always performed with the utmost care and concern for the patient's comfort and safety. After all, the goal is not just to secure an airway, but to do so in a way that minimizes risk and maximizes the likelihood of a successful outcome. Performing the intubation is the most critical step in this life-saving procedure. With the tube in place, the next step is to confirm its correct placement. Now, there are several ways to do this, and each one is as crucial as the other. First off, visual confirmation. Here, we look for the tube passing through the vocal cords and watch for the symmetrical rise and fall of the chest. Simple yet incredibly effective. Now let's talk about technology. The use of capnography is prevalent in modern healthcare settings. This measures the concentration of carbon dioxide in the patient's exhaled air, providing an almost immediate indication if the tube is in the lungs or esophagus. Another method is using a stethoscope to listen for breath sounds. If you hear them equally on both sides of the chest and not in the stomach, you're in good shape. Finally, a chest X-ray can provide a definitive proof of correct placement. Confirming tube placement is crucial to ensure the effectiveness of tracheal intubation. Each method has its place, and together they build a safety net for the patient. Once we've confirmed the tube's placement, we must secure it and provide post-intubation care. Securing the tube is a crucial step in the intubation process. This ensures that the tube stays in place, providing an open airway for the patient. Securing the tube is typically done using a specialized holder or a piece of adhesive tape. The goal is to hold the tube firmly in place without causing discomfort or damage to the patient. Remember, the tube should be secure enough to prevent accidental dislodgement, but not so tight that it causes pressure damage to the skin. Regular checks should be made to ensure the tube remains secure and the patient is comfortable. Once the tube is secure, we move on to post-intubation care. This is a multifaceted process that involves continuous monitoring and management to ensure the patient's safety and comfort. Firstly, we monitor the patient's vital signs, heart rate, blood pressure, and oxygen saturation, to ensure they remain stable. If any of these deviate from the normal range, we may need to adjust the level of sedation or the ventilator settings. Next, we regularly assess the tube's position, as movement can occur due to coughing, patient repositioning, or other factors. We also listen to the chest sounds to ensure they are equal and adequate, indicating that the tube is still in the right place. Additionally, we manage the patient's comfort. This may involve administering sedatives or analgesics to keep the patient comfortable and calm. It's also important to keep the patient's mouth clean and moisturized to prevent dryness and infection. Lastly, but vitally, we need to communicate with the patient, explaining what is happening and providing reassurance. If the patient is conscious, this can help alleviate anxiety and foster cooperation. Securing the tube and providing post-intubation care are the final steps in this life-saving process. And remember, every step of the way, patient safety and comfort should be at the forefront of our actions. We've taken a detailed journey through the process of tracheal intubation. We've delved into the significance of tracheal intubation in medical emergencies, helping us understand why it's a crucial life-saving procedure. It's not just about getting air into the lungs, but also about protecting the patient's airway, preventing aspiration, and enabling better access for further treatment. We then explored the preparation phase, which is as essential as the procedure itself. A well-prepared healthcare professional is a key factor in successful intubation. It's about having the right equipment, understanding the patient's condition, and being ready for potential complications. Next, we broke down the process into clear, manageable steps. Starting with patient assessment, we underscored the importance of thorough examination and understanding your patient's unique needs. This sets the foundation for the rest of the procedure, ensuring you're not working in the dark. We then moved on to equipment selection, a step that emphasizes the need for precision and familiarity with your tools. The right equipment can make the difference between a smooth procedure and a complicated one. Positioning the patient correctly was our next focus. This step is all about ensuring optimal conditions for intubation, setting the stage for a successful procedure. Performing the intubation was our longest stop. We detailed the procedure, giving us a glimpse into the careful balance of skill, knowledge, and calm required to navigate this complex task. Confirming tube placement was our penultimate step, a checkpoint that ensures the procedure has been successful and the patient is receiving the necessary oxygen. Finally, we discussed securing the tube and post-intubation care, highlighting the ongoing nature of care even after the procedure is completed. It's not just about getting the tube in, it's also about making sure it stays there and the patient remains stable. As we've seen, tracheal intubation is a complex but critical procedure in medical emergencies, proving that every breath counts.